This is what I always say, that the MCQE1 is basically targeting doctors who can take care of people who are about to die. So, is the patient in hemodynamic distress? Is the patient in hemodynamic instability? Is the patient in shock? So what you want to focus on is that if I have a patient with lower GI bleed, one of the things I want to pay attention to is the hemodynamic status of the patient, the blood pressure, the pulse, the respiratory rate, capillary refill, the patient's consciousness level. You have to know how you're going to manage a hemodynamically stable patient with lower GI bleed and a hemodynamically unstable patient with lower GI bleed. Then construct an effective initial management plan, including identifying patients in need of immediate resuscitation and referral specialized care. So these are the things you want to focus on so far as lower GI bleed is concerned. And doctors, as I say all the time, if you're able to master these, then you are good. So we're going to review the topic of diverticulosis and diverticular bleeding because we are talking about lower GI bleed. So doctors, let's try some questions. I need someone to read this first question for us. You remember that you told me that you prefer it that we deal with questions and then we do a deep dive. Deal with questions and do a deep dive. So that's exactly what I'm doing with you. So please, let's start right now. Read the first question. Let's go. Answer is C. And I'm going to explain why. Doctors, when you are learning the risk factors, learn the risk factors for diverticulosis, number 1, and the risk factors for diverticulitis, number 2. And I'm going to explain why. The answer is C. Diverticulosis is more common in older individuals. Why? Diverticulosis is an age-related condition, okay? With its prevalence increasing with age. By approximately 60% of individuals with will have diverticulosis. This is a progressive condition that increases in severity over the time. Now, the prevalence is typically higher in the sigmoid colon, that is on the left, as noted in the stem, and it predominantly affects older individuals. Why is A correct? Diverticulosis typically affects the left colon in Western populations, and in Asian populations, it affects the right side. So please, that is the first learning point. I know people are torn in their minds about the diet thing. I will come there. But the first thing is that diverticulosis typically affects the left colon, that is the sigmoid colon, in the Western countries. For the Asian population, it affects the right colon more. Number 2, diverticulosis is more common in males. So that's the second learning point. Please write that down. Particularly in younger age groups. That is, so if you take younger age groups, males and females, you see diverticulosis more in males. Number 3, contrary to previous beliefs, low fiber intake is not the strongest risk factor for diverticulosis. And when I come to the deep dive, we'll get into that. That is the correct answer. So in Asian populations, diverticulosis tends to be predominantly right-sided, unlike the Western countries. But I will give you a trick. Remember that the QE1, we are not writing the QE1 in Asia, right? We are writing the QE1 where? In Canada. So doctors, where should we put our emphasis? On the left-sided diverticulosis or the right-sided diverticulosis? Left-sided. So where you are writing your exam should also tell you where you should put the emphasis, okay? Now, the distinction highlights geographical variations in the prevalence and the location of diverticula.